We're here again talking about the update of the NAACP and things that are happening around the local community. And our guest today is Miss Lisa Rucker. And Lisa, you want to tell us what your position is at the Hospice of Dayton?
Well, thank you, Carolyn. My title is Inclusion and Access Coordinator.
Okay. Exactly what does that include?
Yeah, that's a mouthful. What that involves is a lot of community outreach, working on awareness of what hospice services are available to patients, families, to the community in general. And I also work with doing cultural diversity training for staff so that as we meet those various populations in the communities that we serve, that we're able to kind of incorporate their cultural needs as well in terms of the other services that we provide.
Okay, hospice, to some individuals, that's like that word that nobody wants to talk about because they think the only time you need hospice is when somebody is right at death's door. And we just want to let the community know what hospice is and the many things that you do. So when should somebody call hospice?
Oh, hospice is it's a concept of healthcare in terms of helping individuals that maybe are facing life-limiting illnesses and some of the struggles that they're going through. It's about that focus on quality of life and maybe the time that they do have left to be able to spend with their loved ones and make each day the best possible day that they can. A lot of times people wait till the very last minute. We're dealing a lot of times with various life-limiting illnesses. It used to be a thing where it was just cancer, and that was the thing, and people still just trying to get that awareness, and no one wants to be ill. They plan for everything else, but they don't want to say, oh, I'm going to go to hospice in 6 months. That's not the reality of it. So it's just increasing that awareness so that they can focus on their quality of life sooner and not wait till the last minute. A lot of times the doctor will be instrumental in talking about that, and they may say that it's time to call hospice in, and that's when a lot of the curative aspects are maybe not working as well as they should be, or maybe all the alternatives have been reached and there really is nothing else that can be done for that disease progression. So it's just about that comfort care and doing that. So when people hear hospice, they automatically do think the end, but it isn't. It's about celebrating the life that you have and making you comfortable for the time that you have. And although, insurances may say, it's about 6 months or less in terms of qualification, we all know that the final say is with God,
right?
As to what's that plan for us. So it's just getting the community aware that they can come in ahead of time before they get to those last few days and be able to get the services, to benefit from all of the complementary care that we provide, the team approach with the doctors and nurses, the personal care assistants, the volunteers, just to kind of all work together on that individual plan of care for that particular patient and family as to what's important to them. And a lot of times when you're relieving that stress off of your mind, that makes a big difference.
Yeah, I'm sure it would. When you talk about the family, do you have, say, a segment or area that they have counseling on the grief process, or how they can talk to their loved ones without breaking down or putting stress on them? Is that available, things like that?
Yes, that is. In fact, as we speak, they're getting ready to set up for a circle of caring group, and that's for the caregiver, because that caregiver needs that support so much in terms of when they're dealing with a loved one that maybe has a life-limiting illness, because they're trying to remain strong and not really show that emotion. And it's very hard to not only have that relationship with that person, but to be that caregiver, because that's a 24-hour job, and it's very, very difficult. So we've got classes going on, segments that they're working with the grief counselor to kind of talk about the various aspects of that. The chaplain is there. If they don't have a church home, then we have chaplains available, social workers, and people kind of cringe when they hear social worker, but it's just that connection with that resource support, or just looking to see what else that family needs, whether there's children involved, and what's going to go on with maybe them if in the summer, if they're on summer vacation, how that's going to affect them. So there's just a lot of different support, volunteers that maybe come in and sit with the family, so maybe the caregiver can go get a break and kind of regroup and re-energize with that process. So,
you know, that situation, it kind of hits home to me of when I moved here, that my mother passed away, and not knowing anybody here, and it didn't cross my mind, maybe because of how fast it happened, that there was somebody here.
yes.
So that's part of educating. There's somebody there. And do you have specific folks that talk to children? Because I had teenagers at the time.
Yes, we do. We have a wonderful program. One of our therapists also works a lot with art therapy with children. We have a camp that we do the third weekend in June. It's Camp Pathways, where we take a group of children, probably about 45, 50 children, along with grief counselors. Each child has a buddy, and we go down to Camp Joy Education Center in Warren County. And it just gives them an opportunity to know that they've got the support there. They're not by themselves when they've lost someone that's very important to them. And more importantly, that they can still have fun and just be a child, because of all the stressors, all the things that they go through now that, you know, that they see, even with the violent deaths or the natural deaths. And everybody expects kids to just not be paying attention to that or just be okay. And they're carrying a lot of those stressors to the school, to any environment, and then, you know, they want to say, well, what's wrong? Because they don't know how to express themselves. It's difficult for adults to learn how to talk about grief. So it's very challenging for the children to be able to do that. So they may take that out in art or just different activities to be able to do that. So that support's there. We started another event in January of last year that was like a breakaway, and it was done at Vandalia Rec Center during Martin Luther King weekend. And it was just a day activity with kind of like a shortened version of the 3-day camp that we do in June, to give them that opportunity to be there with the grief counselors. So it's important. We go out to schools if they've lost someone in their classroom, if it's a teacher, if it's a student, where that's available to the schools, it's available to businesses for coworkers. And all of these opportunities are free of charge. Through, you know, as being a nonprofit organization, we're able to kind of really offer those things back to the community and be that support.
Okay, that was something I wasn't aware of, that you go out to schools, that you're involved in that counseling. You know, you hear it on the news, you know, that they have counselors coming, but I didn't know that hospice was involved in that.
Well, and generally that is not, when you hear that on the news, that's not per se us. There's other organizations that do that. To specify a lot with the grief training, and some of the counselors have had that through the schools as well. But with so many things that are going on in schools now, and home situations, we are there to kind of lend that additional support. People don't always take advantage of it because, again, they're not aware. But it's just increasing that awareness to be able to say, you know, that's available, because a couple sessions may not be enough for some of the children. And we don't conduct all of that out in the centers, but they have an opportunity to come to the different grief sessions that we have there at hospice.
That's good to know. And
just recently, we've opened an office in Wright Dunbar location, and we'll be doing grief counseling sessions out of there. So.
Well, that's good. Can anybody, no matter, you know, let's say, you know, because there's so much violence in the street, can anybody or a family come to you and ask for that help?
Yes, it's open to anybody in our Service County area. They do not have had to have been involved with our services at all in terms of losing a family member through our services. It's anyone in that community.
Lisa, can you tell me some of the other services that are provided?
Okay. Well, in addition, we talked briefly about the grief counseling services that's available. Palliative care is a program that we're also offering to individuals, and that's more with individuals that have life-limiting illness or chronic disease or serious disease process that maybe are involved with a lot of pain. So if they're going through the hospital and maybe they're identified that, we're working in conjunction with the hospitals. And those are the steps before hospice. You know, that maybe we'll work to get the pain and symptoms under control. So that's very, very important. Volunteers are very key with our program. They're that additional step to kind of find other ways to meet the needs. They sometimes have that connection with just sitting and talking. You can learn information from somebody that maybe is not a medical individual,
Right.
that you have that camaraderie with, or that comfort level with, and they share that. Families have an opportunity, if they want to do a life video, to kind of leave as a legacy, you know, to their family members. They do theme nights. If individuals have to come into the hospice house, then there's different theme nights that they have in connection with holidays, and volunteers are working now with different things for the upcoming Christmas holiday and the Thanksgiving holiday to share with individuals that, you know, are away from their home at that point in time, you know, just to make them more comfortable.
Right.
One of the hidden secrets is that, you know, when people don't, with the hospice houses, they don't really step in there because they think it's doom and gloom. You have individuals that are coming in, different groups that come in and sing. During Black History Month last year, we had a group of ladies come in from the Wesley Community Center, and they came in and sang some songs. Different schools have come in. We've had memorial services there. We've had weddings there. We've had a ballroom dancing session in our great room that's available for use of any of the families there. Our community room is open to any nonprofit organization. If they want to hold their monthly meeting there, that's free of charge. So, and there's a lot of different things that, you know, people come in and say, I didn't know hospice did that. It's a very calming, peaceful place to be able to kind of come in and you just kind of relax. You know.
It sounds like more a celebration of life than death, you know.
It really is, and that celebration of life is different for everybody. We all determine what our quality of life is, and that's kind of what we focus on. One of the other things that we do that people are not aware of that's involved is occupational therapy with hospice. And they go, occupational therapy? Why would people need that? But maybe someone that's been bedbound and that they've enjoyed getting outside or gardening, and they'll work to get some adaptable resources or mobile devices to get them back outside. We had an individual that loved to fish, and they were able to, he'd been bedbound, and they were able to get him outside and simulate that. We've used the Wii in terms of individuals that maybe want to go golfing or bowling, and they set the Wii up, and it simulates that activity that they're able to do. And, you know, it's just some of those little things, because a lot of times when people are facing life-limiting illness, it's the things that they're missing in life that really kind of is that constant reminder, you know, that they have an illness. It's being able to, you know, get back involved with your family or maybe some social groups. We had one gentleman that was involved with a social group, and so the members came there, and they wheeled his bed down to the great room, and he was able to participate in that, and he hadn't been able to do that in months. So it's going back to the basics. It's just those simple things that we find give us comfort, you know, that we can enjoy, and that's, I said, that's different for everybody. So it is about celebrating the life you have, you know, as to what's important to you. People come in with different foods. They have an opportunity. If there's something that we can provide them on the menu from our cafe, if we can't make it, we'll get it for them, you know. So it's just that important, that individual care and that care plan that makes a difference to just kind of help support the family and the patient.
But you say, well, say for instance myself, I could come in and try to set up something before I would get to where I was incapacitated. Is that possible, or do you have to wait till a certain
Well,
age
there
or
are there are specific disease criteria. As I said, it's not just for cancer; it's any life-limiting illness. So there are stipulations or criteria that you have to meet in order to qualify for hospice services. Okay. Now, again, if you don't, that means that you might be able to qualify for the innovative care solutions with the palliative care, and those are the steps before. But initially, if anyone can make a referral, but the family and the doctor have to agree that it's at that time that it's ready for that referral to be made. If not, we may have community resources that we can, you know, direct you to, or be able to say this might help. But you have that information, and that's the key thing, is being able to get that awareness out there before it becomes that crisis point.
Right.
To be able to do. And if you don't qualify at that point, but at least you have the information to know this is kind of the things to look for. These are the resources that will be available to you. And our community needs to have that additional time, because it's when you're dealing with those stressors, it's not an easy thing to just say, this is what I'm going to do, because they think hospice is about giving up. It's not giving up. It's getting that support that you need for not only yourself but your family, to be able to come in and work alongside with you, whether it's your family members, whether it's your extended family, whether it's your church home, just anybody that that you find important to you. It's helping get that support for you and for them.
That's kind of nice to know. And I want our audience to know that we should think in terms, as you said, that this is a celebration of life.
Exactly.
And even though the end is in sight, we're celebrating what has been there and what will continue to be after that person is gone. You'll have those memories, and it's not like being sick and being bedridden in the hospital or at home.
Yes.
And that person can't see anybody or do anything. So it does have kind of, for lack of a better word, a nice ring to it.
It does. And individuals that come in, they're so surprised at the surroundings. There's just recently some of the things that we've just added. It's a solarium, so if people want to kind of enjoy the plants, to be able to do that. Music that they've got in each of the patient suites, they can pick their genre of music. It's just anything possible that we can work toward. And sometimes maybe our limited resources, we collaborate with other organizations. We had a young man that was in there, and I think that's another stigma, is that it's just for the elderly. It's anyone that we deal with that's 18 years or older. And he was in his 20s, and he loved wrestling.
Oh.
And we were able to, and he was bedbound, but we were able to work with the WWF and the Nutter Center and get him out there by ambulette, and he had an opportunity to meet all the wrestlers and flirt with the girls, and that was just the best opportunity for him, that he could just imagine. And again, that's back to that quality of life.
It's kind of like Make-A-Wish Foundation. You made a wish of his come true.
Yes. And that's what the quality of life goals are about. The patients have the opportunity, the families have, what do you want to achieve with the time that you have left, and kind of focus on that.
Well, that's a good thing. Now, I know there's several different names of hospice. Do they pretty much run the same way?
Well, hospice care, the concept of hospice that I talked about was just with that support, and with that life-limiting illness, that focus of assisting someone that's on their journey home. That's the concept that is continuous and runs throughout.
Oh, that's good to know.
There's services that we provide, the same with the NHPCO, but you're always going to have to try and look to see what else you can do to provide to the community. And we've been in this area. We'll be celebrating our upcoming 35th year in the community. So just kind of extending, just reaching out to find out what's there, what is needed, an assessment of those community values, being involved in servant leadership, to kind of go out to the communities and talk to them and say what's important to you, and kind of incorporate that into that plan of care.
I was in a job that used a lot of initials for things, so you mentioned NP something?
National Hospice and Palliative Care Organization.
Oh, okay, gotcha.
Yes.
I know how that is when you're talking and that comes out and everybody's like, what?
Yeah.
And that's what hit my mind is, what did she just say?
Yeah, it becomes kind of rule of thumb, and that's kind of also the concept of hospice, is people that are in it have that understanding. So it's increasing that education, it's talking to different groups, it's health fairs, it's just meeting people. A lot of times if I have my badge still on and they'll say, oh, you work at hospice, and it's just getting that information out there, and they always have a story to share, to talk about different things. And although we're not connected, the whole focus is making sure that that quality care is there for families.
That's great. And I was looking when you said your badge and like that, and I'm a pen collector, and I was looking at the pen, and I know that's the emblem for Hospice of Dayton, but
Yes, it
it's
is.
just the colors are so calming, and that that's part of the thing with hospice, a calming feeling
Peaceful
that you
effect.
would get.
Yes, yeah.
So,
This is our new logo. So we've
okay,
had this for about a year now.
okay.
So again, there's a lot of different, again, that celebration and try and get a different focus on what that experience is with hospice.
Well, I was gonna say I hoped everybody learned something from this because I learned a lot.
I
It
hope
was,
so.
some things I was aware of, other things I weren't, and that's what we want to do is educate our community on what's available, and because we know medically the folks, and it's anybody, but especially in the African American community,
Exactly.
when it comes to health care, and it comes to whether it's death or whatever, that's sometimes we wait to the last minute to go to the doctor, and we wait for the last minute to to see about things, whether it's a funeral, insurance, all that kind of stuff.
Right.
So that's why we have you here, is to tell us what hospice is, and to kind of inform us about things that are going on in that area that most of us don't even have a clue.
And it's so important because I was at that step with everybody else when my mother went through Miami County into hospice. And the first idea when somebody said it's time to bring them in, I was very angry and say, absolutely not. So again, that's why I said it's so important to get that information ahead of time, to get that awareness, because as I watched her kind of progress and her disease was making a different person out of what she was able to do, then I did allow them to come in and do that. And so I changed from what I thought hospice was to what it really is, and that's support for the family and for her to be able to have a peaceful, comfortable passing. That was just so important to me, the support that they were there with me to let me know that everything was okay. The words I still to this day remember, the words the chaplain shared with me, that made a big difference in terms of being able to let her go and be at peace with that and celebrate what she left me as a legacy.
Well, in winding this up, I want everybody out there, we've tried to educate you on what hospice is. There's still a million other things, but it's not about who you select. It's about taking time to educate yourself. So get in the phone book, find out where the hospices are, and give them a call. If you got any other questions, I'm sure Ms. Rucker's organization is available. And I want to thank you so much for coming.
Thank you for having me. I really enjoyed talking with you.
And I enjoy talking with you. So we'll be back again with a new show, and we're wrapping things up today, talking about the hospice community. And again, thank you, Lisa, very much for coming.
Thank you.
And I enjoyed the information that I gained.
And just if you know somebody that may need that additional awareness, it's important to share that.
Okay. See y'all next time. Bye-bye.